Okay, hi everyone. Welcome to the second WISE session of the fall quarter. Can everyone online hear me okay?
Yes.
Great, we can hear you perfectly too. So this is a really exciting session for WISE. We've been talking about it for a very long time. About a year ago, there was a big interest in WISE members to start to learn more and really focus on policy implementation science. A sub-working group has spiraled out of that conversation if anybody wants to be added to that listserv, and it's really kind of culminated in this talk today that we're really excited about, where Dean Jodi Sandfort is joining us. The plan for today is to, Dean Sandfort is going to give a talk for about 45 minutes. We'll take some questions, and at the very end, this new exciting initiative called Lapis will be introduced, and we'll have some time to talk about that as well. And that's, I think David or Yongfeng is gonna take over at that point, right? Great. Well, without further ado, I'm going to introduce our guest speaker. So Dean and Professor Jodi Sandfort from the Evans School of Public Policy and Governance here at the UW is joining us today. Her work focuses on improving implementation of social policy, particularly policies designed to support low-income children and their families. We were just talking about this. She's been a leader in the policy implementation science space for a long time, before we had a PhD program in implementation science, for example. And I know I've read a bit of your work that's really interesting around replication and innovation and context, which is all stuff that we talk about in WISE. And including a book called Effective Implementation and Practice, Integrating Public Policy and Management, which I've bookmarked on my reading list, actually. So yeah, thank you, Dean Sandfort, for joining us. And
great. I would love if we can go around, because I really try to target my remarks as much as I can to the audience that's in the room, because this is a very well-known implementation science cluster, and curious to see who is joining you.
yes. Perfect. Yeah, that's great. So we can all go around and briefly introduce ourselves, what our kind of positions or roles are. So I can start. I'm Ariana Means, and I'm an assistant professor in the Department of Global Health based in Global Watch and the Implementation Science Program. We'll do the room and then we'll do Zoom.
Sounds good. David Watkins. I am an associate professor in the Department of Medicine and Department of Global Health. And I work in health policy and systems research broadly, and I'm the co-director of the Lapis you'll hear about soon.
I'm Stephanie Edlin Cho. I'm the program operations specialist at Global Watch.
I am Kelly. I am the grants and programs manager for Global Watch, and am just very interested in policy implementation science.
I am Alicia Peresu, and I am the program operations specialist for the Global Cardiovascular Health Program. I'm also working on the coordination of the new Lapis initiative as well.
Hi everyone, my name is Mohamed Al-Brer. I'm now a fourth year PhD student in the implementation science program, and I'm interested in applying mathematical modeling to inform policy.
All right, so I'm just gonna go and call on people based on how they appear in the Zoom box. So I hope that's okay. If you want to come off mute and give a brief introduction, or if you don't feel comfortable, you can just put it in the chat. So the first person in my Zoom box is Patience.
Having breakfast.
Hello, everyone. My name is Patience Amimamaka. I work with the Ghana Health Service as a municipal director. I belong to cohort 4 of IPPHL. And I had a privilege of being taught during the program by Jodi. Thank you.
Nice that you're here, Patience.
Thank you.
Anjali.
Hi, I'm Anjali Wagner. I'm an assistant professor in the Department of Global Health and co-lead WISE with Ariana and Kelly. And I'm really thrilled for this presentation. I'm sorry I couldn't be there in person, but I send you greetings from Nairobi and appreciate you being here.
We were just speaking about Nairobi.
Emily Robson.
Good morning, everyone. My name is Emily Robson. I use she, her pronouns. I'm a recent graduate from the Global Watch Certificate Program and where I also got my DNP. I am now in a new role within Washington State where we're working on implementing health interventions, both within the health ecosystem and on a policy level. So I'm excited to hear from you today.
Thank you. Sarah Shaw.
Hi, everyone. My name is Sarah Shaw. I am now a third-year PhD student in the Implementation Science program, and I'm currently here in Nairobi working on a project focused on scaling up an evidence-based intervention with a great team here.
Thank you. Beth?
Yeah, good morning, everyone. I'm Beth Dunbar. I work with Nancy Puttkammer at the Digital Initiatives Group at iTech, and then I'm also a PhD candidate in Human-Centered Design and Engineering.
Great, thank you. Sao Bang?
Hi, good morning. My name is Sal. I'm a second-year MPH student in Department of Epidemiology, and I work on PrEP delivery in China.
Thank you. Elizabeth Glean?
Hi, I'm Elizabeth Galeen. I'm a research associate over at the Fred Hutch and an acting instructor in the Allergy Infectious Disease Division at UW. I'm working on projects at the Uganda Cancer Institute related to implementation of antimicrobial stewardship programs.
Thank you. Kate Rankin?
Hi, everyone. Good morning. My name is Kate Rankin, and I'm the Managing Director of Global Watch. Happy to be here.
Thanks, Kate. Yan Feng?
Good morning, everyone. I'm Yang Fang Su. I'm an assistant professor of global health, and I'm also co-directing the LAPIS initiative with David and Alicia. Welcome, Jodi.
Thanks, Yan Feng. Nak?
Hi, everyone. My name is Nak Chen. I'm a fourth-year PhD student in the Implementation Science program. I'm really excited to hear this presentation. Looking forward to it. Thank you.
Thank you. Tessa?
Hi, everyone. My name is Tessa Concepcion. I'm sorry, that's my dog. I'm a second-year PhD student in Global Health Implementation Science.
Thanks, Tessa. Hillman? I'm sorry. Hilma?
Hi, everyone. Sorry. My name is Hilma Nakambale. I'm a first-year implementation science student in the Department of Global Health. I'm excited for this presentation. Thank you.
Thank you. Megan Ko?
Hi, my name is Megan Ko. I'm a third-year PhD student in the School of Nursing and interested in implementation of clinical guidelines and within facilities and within hospitals. Thanks.
Thanks. Jennifer Atala?
Hi, everyone. I'm Jennifer Atala from Uganda. I'm currently working on projects related to implementation science. I'm excited to be here today for that. Thank you.
Thank you. Sarah Masuko?
Hi, good morning, everyone. My name is Sarah Masuko. I'm an assistant professor in the Department of Global Health, and I work a lot in terms of HIV and cardiovascular diseases. And I'm really happy to hear from you, Jodi. I've worked in the Ministry of Health for a long period of time, so policy is really my passion. So I'm looking forward to hearing from you.
Thanks, Sarah. Cyrus?
Hi, I'm Cyrus Mugo from Kenyatta National Hospital in Nairobi and recent EP graduate at UW. And my interests are in implementation of mental health services or integration of mental health services in HIV care.
Thanks, Cyrus. Chloe?
Hi, I'm Chloe Morzoff. I'm a second-year PhD student in the Department of Global Health studying implementation science. So thanks for being here, Jodi. Looking forward to your talk.
Anna?
Hi, I'm Anna Kraus. I'm a first year global health PhD implementation science student and looking forward to the talk.
Thank you. And Liz Harrington, I know you joined late, but we're just doing a brief introduction of who we are so that Dean Sandfort has a better idea who's in the room.
Yes, thank you. I'm Liz Harrington. I'm an assistant professor in the Department of OBGYN and yeah, really interested in the presentation. Thank you.
And Kristen, I know you just joined, but we are doing very brief introductions of who we are so that Dean Sandfort has an idea of who's in the room if you want to pop off mute real quick.
Hi there, sorry for being late, trying to find a quiet spot. I'm Kristen Danforth. I'm a research scientist here at in the Department of Global Health, and in my last dregs of my PhD in implementation science, with a focus on policy. Primarily work with Yan Feng and David and colleagues on some work in rheumatic heart disease in Uganda and surgical care in Malawi. So looking forward to hearing the talk. Thanks.
Thank you.
Thanks. Really helpful. I know it's for you all a little boring because you know each other, but because I don't know you and because my assumption was a slightly different about who is in the room, I'm going to adjust as we go. Can you pull up my slides? Yep. So Yanfeng Zhu and I have been talking together for the last year and a half about this topic. And I told her, you know, it's funny because I've known about this really strong cluster of implementation science at the University of Washington, Seattle for, you know, over a decade. And part of what's very interesting to me about this topic is how much the world that you are in is different than the world that I am in. And I think there's a lot of reasons for that. And I have a story I remember so clearly. I was in Ireland at a meeting of the Global Implementation Society. They have this global implementation conference. It's scholars from your world and practitioners, and had gone because one of the leading network scholars in my field had said, oh, you should go to that as you're working on your book. I knew nobody at that conference. And he said, he kind of warned me. He said, this is going to happen. And it actually was true. And I think part of it stems from the fact that we're actually asking fundamentally different questions. The questions that many of you are interested in is, how can you take what we know from research-based knowledge and replicate it and assure that attention is paid to the organizational context through that, trying to figure out how to parse out and really learn from what works. The question that people in my scholarly world are interested in is trying to create explanations for why is implementation so unpredictable? Why do we see in almost every case variation that almost defies prediction? And so I think because of that, and because of the different literatures and the different methodological traditions, it has meant that there hasn't been much intellectual cross-fertilization between these worlds. I will also say that the implementation science world is massive, right? It's built, you've been building journals and not only in the public health space, but in psychology sections and, you know, other things. And that is not true of the policy implementation space. And in fact, when we started to do the research on our book a decade ago, people said to me that literature is dead. You shouldn't do it. And to me, I felt like I'm watching people in governments, nonprofit agencies, foundations implement policy every day. We need to create better explanations to help them orient themselves to figure out how to work more effectively in the context within which they find themselves. So that is really what's propelled my work. So what I wanted to do today is just do a little bit of orientation to the literature on policy implementation and innovation. Actually, those two things, as we've dug into this, are clearer and tighter than I had expected in the past. I'll talk a little bit about how that framework, that theoretical orientation allows us to develop intervention points at the systems level and really think about with you, are there opportunities for better collaboration and coordination? Funny, it works. Click and for those of you online. Okay. Let me see. Can I have the yeah. Keep going. I want to pass through a few of these. Yes, that one. Okay. So in the study of public policy, their implementation was a topic that was created when the public policy schools were created in the United States and globally in the 1970s. And it was really because policy schools were created because social scientists believed that economics and political science needed to be brought to help policymakers make better decisions. So Mohammed, almost like what you're saying, wanting to use models to create better policy information. And when they did that, it was really clear that things weren't just about policy formation, they were also about implementation. And so what happened is in the 70s and 80s, there were hundreds and hundreds of case studies that said, what is the implementation of this program? Most of them were in the United States, but then they were global as well. And the basic conclusion was everything matters in shaping implementation. And then people started to do what I think many of you in implementation science are doing, which is to try to model, use multivariate models to really figure out what are the variables that seem most important around issues of fidelity. And the 30 years of exploration in that was basically to say the models are too complicated to be of much use. And so that's really where the focus on implementation as a subfield in policy kind of receded. And really other people started using more elaborate methodologies to explore implementation. And so in the book we lay out, there's kind of three major traditions where people have tried to look at implementation. The first wave were these case studies coming out of political science that was really focused on top-down implementation, bottom-up implementation. How do you understand how power is working in these policy systems? In the 80s and the 90s, more of a focus on the management of complex systems evolved, organizations and networks, coming much more out of public administration and organizational science. And in that, we talk a lot about the different ways that government tries to shape implementation through government tools. So in a policy that I'm working on right now, the state of Washington has passed a public insurance program for paid maternity and medical leave. They're using the tool of public insurance. In other policies, you use contracts or grants, tax credits. And so the literature there really focused on the mechanism of investment that government's trying to make. The third tradition is really more similar to the way you all think of it in implementation science, which is looking at interventions. Behavioral science is a big deal in policy, where we're trying to understand little micro changes in the intervention and what kind of impact does that have on take-up rates or access. And that literature has been very helpful, but one of the things we know is that little tweaks in an intervention may have small influences on the results that we carry, but there's this whole other larger system, which again is I think the conversation you all are probably having. So what we've tried to do in our work is to say, okay, what are the key conceptual and theoretical ideas from these different disciplines, and try to integrate them again with the focus on the implementers, to help implementers have frameworks so that they can be more successful. I would say there were some real gaps we felt like when we looked at those literatures about how do different parts of a policy implementation system operate in the implementation challenges or the implementation tasks. There are things that happen at the macro level and through networks that are trying to set up the terms. There are things that happen in organizations, and there are things that happen at the front line. How do you understand the variation in the organizational settings that are really shaping the implementation process? How do you think about the results of implementation, both in terms of how systems change, but also how the people who are targeted by the policy change? And what can you do to try and improve implementation? Again, some of these questions align very much, I imagine, with some of the discussions that you've been having. So what we really realized is that we wanted to talk explicitly about policy that's trying to create public value, and trying to think of implementation of when it's effective, it's intentionally trying to improve public value. And in my world, that means effectiveness, equity, efficiency, depending on the policy and the context. Also wanted to really help people in my world realize that at its core, implementation is about change. It's about trying to make a change in systems that just because a policy was passed, people are not convinced that they should change. Because implementation requires a lot of people to change, and perhaps not a lot of reason in their own minds that they should. And that's kind of the crux of the problem that we were realizing. And so we wanted to develop a process theoretical explanation for what does it mean to change around a policy or program, and how can you create some language and intervention points to increase the likelihood that people will make that change. So, oh, now I can't go back. Oh, can you take me back to, thank you. One more. So core ideas that we developed in the book and in the other theoretical and empirical studies since, and that's being picked up by people in a lot of different fields, is to think about policy implementation as happening in complex systems that have multiple levels. The most macro is what we call the policy field. And this is really the networks of institutions that come together to try and implement a policy or program. Implementation also happens at organizations, right? And we differentiate different kinds of organizations. Some provide services, but others of them have the role of authorizing the policy through funding, through rules and regulations. And implementations always have a front line. Sometimes it's a nurse in a clinic. Sometimes it's a web portal interfacing with the target population. And that we have to understand the way that sense is made about the policy at each of those levels in the system. We focus attention on the core program. So this idea of multi-levels is not unusual in policy studies, but oftentimes then they'll just talk about governance broadly. And we, like you, are really interested in having a core intervention. Sometimes in our writing, we've called it a program technology because sometimes it isn't actually honed very specifically as an intervention. You know, the legislature may say, we want to, improve or, well, let's say Washington State, improve voting. It's not happening everywhere, right? But they might not give much details around the intervention itself. And part of the implementation process is defining what that core program intervention is. And in our framework, we need to accommodate that as well. So I'll talk more about this, but the way we then thought about the environment around the implementation process is that in each of those settings, there is something that we think of as strategic fields of action, where people and individuals are interpreting and challenging each other and trying to define what do we think that policy or program is where we live, where we work. Because as they define it, it really becomes how they operationalize it. We talk about a couple of mechanisms that matter significantly in policy. In the 70s and 80s, they thought, oh, it's all about the laws and the rules. You know, if there's a regulation or a rule, that's what's going to determine. And funny enough, people don't always follow the rules and regulations, right? Sometimes in the United States and Europe and New Zealand, there is a lot of focus on market dynamics, performance in the implementation of policy. And sometimes those ideas define what the intervention is. But other times, professional norms. And part of what's been beautiful to see about the work of implementation science is I think you've created in public health, in parts of education, a whole professional expectation that people need to pay attention to implementation as a topic, right? And that changes how people respond to a policy or program that shows up on their desk. They think of it as part of their professional identity. There's also the cultural, organizational culture, other interpretations that may challenge that professional ideology. Oftentimes when people are saying, well, I've done this for 20 years, 30 years, this is the way it's supposed to happen, not this new policy or not this professional association. So the strategic field of action, which I'll talk about more, is kind of a way to talk about that contested space that surrounds a policy or program. Another piece that's really important is that in the model, people and the social skill that people possess really matters in determining how the policy is understood. I'll say a bit more about that. The other thing that we did, which I think might be of useful use to you all, is that we tried to really specify what are the outcomes of the implementation of policy, and really wanting to make sure that people are tracking this. Sometimes policy is focused on changing systems, and other times it's target groups, and sometimes it's both. Ultimately, if you're successful in implementing a policy through an implementation system, you're going to integrate it into the daily operations of that system. And you're going to have the desired change in the target group. But there's a lot of other ways to operationalize some of the process quality outputs as well. So for example, right now we're starting a study of the implementation of paid family medical leave in the state of Washington. And we're sitting down with the leaders at the state agency to say, okay, we're going to help you redesign this system, but what are the indicators you really want us to maximize as we work with you to try to improve the implementation? I should also say, please stop, because I might be, please ask me any questions and online too. I'm trying to not use language that is totally bizarre to you, but there may be some things that seem very bizarre to you. This is a simple model. The idea is there's a program, technology, and intervention that moves through the system, and it changes depending on the field. The reality of it is, though, is that those fields are not that simple. And so what we try to do is figure out how can we talk about the fact that there's multiple actors, multiple sites and service organizations that are involved. And so we turn to social theory, which might be a little bit different than what many of you use around this table. There's been a lot of development in that over many, many years, 30 years, that's trying to understand people in systems, basically. And this idea of strategic action fields are really these places where people will know what the rules are of the setting, but they try to challenge and push on it. So this theory has been very helpful to me as I've assumed this role of dean to understand, how does my faculty work? It's a strategic action field. The faculty will come in. Yesterday, we passed a new program. They came in having an understanding of the rules of how we make decisions. And by a little encouragement of agency of some of the faculty, they're beginning to change those rules and change how they understand new initiatives when I bring them forward or when other members of the faculty. We all operate within lots of strategic action fields all the time. Our argument is that that way of understanding social learning can be very helpful in understanding why is implementation so complex. The what is really, again, this idea that people shape these social systems. And it is really around how are resources deployed. So in the paid family medical leave example, the way that people at the state are interpreting this new insurance and bringing resources to bear is fundamentally changing how that policy is implemented in Washington, because they've been investing in research. They've been investing in marketing. They've been investing in outreach to employers and redesign of web portals. The state next door, Oregon or California, also have these same policies, but are not bringing resources at the state level to bear. And it really is because the people in that setting don't see their own agency. And they don't understand that they could shape implementation dynamics pretty substantially if they understood that those resources and that leadership can make a difference. And that's why we were just talking about the IPPL program, and Patience was talking about that. It's a program that we run for public health leaders across the continent of Africa. And part of what you do in a leadership program then is help people understand their own agency and help them identify where are the resources that they could draw upon to improve the implementation of programs in their context. That's a very different set of problems, right? Than how do we help reproduce with fidelity an intervention that works. Mine is a lot more ambiguous and a lot more helping people try to make judgments in really complex situations where the way things have happened before may feel most comfortable, but if you continue to do the things that have happened before, you're not going to implement the change. And so that's why in the theoretical framework, this social skill, the ability for leaders or managers or actors of any type to reflect and motivate other people and say, hey, actually, we should do this change because of XYZ value we had. It's really helping people to say, this isn't just something you do as a person for your own ego, but it's actually really effective to trying to move forward the kinds of changes that policy is trying to make. So all this means that in any particular field, at that policy field level, organizational level, or frontline level, you have this constant negotiation among those different levers to try to figure out what do we think the intervention is, and how can we bring that into being. Again, sometimes rules will limit what actors can think is possible. In the Washington State Paid Family Medical Leave Act, they must, provide the benefit to this kind of people. It's in the law. But the law is always insufficient. And sometimes if the law contradicts people's professional norms, they'll subvert the law. Sometimes there will be built-in financial incentives, right, to increase the likelihood that a private organization will step in to help the implementation. But again, that formal mechanism is often very blunt. And so part of the empirical work that's happened since our theoretical framework has come out is to say, actually, many of us think that laws and regulations and market forces, what we think of like the hard ways of influencing implementation, are the most effective. But these soft ones, the more informal ones, oftentimes are where when you're trying to improve implementation, you have more leverage. And again, I think that's why the gains made in your part of the field in kind of creating the expectation that professionals should attend to these things have been really impactful. The challenge is that it's not just that this kind of negotiation is happening at one field, it's happening across the systems. And that brings a lot of interesting empirical questions. Why do the same kinds of organizations and the same implementation system interpret the policy differently? How do frontline actors and supervisors try to create the conditions within which people can thrive? So in your world, Carl May has done a lot of work that's very consistent with this at the frontline level. And again, for me personally, it's really helped me focus again on the importance of individual agency and what in our framework we call the social skill, which is really the ability of people to interpret all this complexity and say, actually, this is the way that we're going to use the resources we have to try to improve public value. So again, with the project I'm currently in, to watch the state make very intentional interpretation about the importance of evidence-informed decision-making in their implementation of the law, and helping them to deliver on that has been very helpful. But it makes me as a scholar not take this for granted, but really see my work with people as theoretically informed, not just because I like them or because they're funding research, but because actually they need to continue to become more sophisticated in their interpretation and evaluation. Some other things that people have started to look at is how do individual people transcend these fields. So I've always been interested in people who may be known in their communities as being a very good frontline practitioner. In my world, it's social workers often, who then are identified by their organization, or they'll be brought up to testify in front of Congress or a legislative body. And you think, well, who are those people and how can they transcend those boundaries and use language that actually resonates with both? And so I brought this up because actually for me in my teaching, it's been helpful as I teach my policy implementation class to help people become more sophisticated at what level at which are they working and how can they be intentional in the language that they use. Knowing that talking about this theoretically, that the terms at the front line that are legitimate about the nature of an intervention may be quite different than the terminology and the frameworks that are used at the policy field or macro level. You guys understood that. I think this concept might be interesting to you all. In this part of the framework, we're just trying to describe how is the implementation activity different at the different locations in the field. And when I talk to students, I start my class and I say, what level have you worked at? And in my world, in policy, many times people have worked at the front line. They've looked at the implementation systems that they're working in and they said, this is screwed up. I'm going to go to policy school and learn how to change it, make it better, like that. And that is really because at that front line is where you're enacting the policy. In my world, probably similar to your work. One of the challenges is that very few people say, my job is to implement X. They think their job is to teach kids or to provide healthcare or, and so part of, I think the implementation challenges is creating enough space so people say, yeah, this is in my job description, it's part of my identity. And again, I think that's where the implementation science world has made really significant inroads in certain fields. The organization has actually become my personal favorite unit of analysis to work at for my own work, because I have to laugh sometimes to think how naive policymakers are about their authority. They'll say, oh, we're going to pass this policy and things are going to change. And they don't realize actually institutions, organizations are most resilient, right? They're not going to change unless people believe it or have such significant consequences for not following that they will change their operations. But one of the things we find is that if an organization knows how to do something and they get a new policy, they're going to integrate that policy into their current operations rather than having the policy change their current operation. So the example of my current project with the state here on paid medical leave, that state agency happened to run the unemployment insurance. And so they built paid family medical leave, just like unemployment insurance. Similar portal, similar rules, similar staffing, and yet this policy is supposed to reach a very different target population in a very different set of circumstances. And so one of the things that they're investing in is trying to then change the understanding of that policy in that organization, and they're bringing in outsiders to help them with that in that strategic action field. The policy field is really the level where these policy tools like contracts, grants, et cetera, and different kinds of implementation resources are what we call assembled. I've also found this unit of analysis to be very helpful because I used to work in a foundation. And one of the things that strategic philanthropy talks about is how do you provide implementation resources to the field? Sometimes this can be trainings, peer learning networks, marketing campaigns, other things like that to really help bring into alignment what's going on in all these subfields into the idea of public value that the program is supposed to be created. This also is the place that once the policy field decides how to think about the intervention, it becomes very, very difficult to change. So an area that I've done a lot of research in is early childhood policy in the United States. And one of the challenges of the implementation system in that particular domain is that the government over the last 70 years has had very different policy approaches that have activated very different infrastructures and networks to implement the policy. And because that's kind of gotten set up at the policy field level, in this context, it's childcare subsidy to decrease the cost is implemented very differently than the Head Start program, which is implemented very differently than child-based preschool in education systems. Because that's set at the policy field, it becomes very, very difficult to change the core program and how it's understood and how it's resourced. And so one of the big empirical questions that some people are exploring is how do you change that and bring it closer together? This, I think, has been an important descriptive framework for people to really think about when they're studying, what level are they studying? And then given that, what are the questions that come into play? So for us, across a lot of articles, I think our critique of the implementation science world is that when we're talking about this question of fidelity, the modeling is challenging, right? Because you end up treating the environment as exogenous. And you have a lot of variables and we don't know the mechanisms within those. And from my perspective, doesn't help practitioners very much. It doesn't really help people to think, how might I improve implementation from where I sit? And so we believe a better question is, how do you help individuals within these systems create learning and change around the core program technology? And again, in some of the worlds that I imagine is adjacent to the implementation science here, this is exactly what you're doing. You know, plan, do, study, act, the continuous quality improvement kinds of cycles. It's really focused on that question of how do you help systems learn? In the end, I just think it's very important to try to help people understand how they can make a difference in these systems. And as I say, there's too many error terms, too much in the error terms in the models overall. So I say that because innovation then becomes very close to implementation. If you think of implementation as about making change, and you think of it as requiring the disruption of these strategic action fields, then the literature on innovation becomes really, really helpful, because if implementation success is ultimately how much you make change in the system, that's actually what innovation and innovation scaling is all about. And I remember I was in Europe doing a doctoral seminar in this, and one of these European students said, well, that's the way they define innovation in my field. And I was like, wow, in public policy, these two things are rarely talked about together. And yet they end up being very, very similar. So I'm feeling very much like I'm talking too much. So I think this is going to be my last slide. I think for me and Stephanie Moulton, my colleague, a lot of scholars are using this framework to try to understand what, which is, I think many of you are interested in that question. What is the important factor in the various places? I also think for me, this focus on know-how and how does individual and collaboration among individuals change the policy context? How do the rules, routines, culture, resources, how are they changed as policy is implemented? And how do you try to move between these fields, realizing the role that individuals and structures play in shaping what is? And so for those of you in the room and maybe online, I just shared this chapter because I think it's maybe a more accessible way, you know, of some of the framework, some of these concepts. We have some theoretical writing that over time I've just been feeling is less and less accessible. So wanted to share this particular piece with you. I will also say that this orientation has meant that I have started in the last 6 years doing much more intervention-based work at the systems level. I had this moment when we finished the book and I had these fancy publications. I was like, okay, I can spend my whole life testing and writing about this framework, but I'm not convinced that that's actually going to help improve implementation. For me, it felt like university needs to bring our knowledge of complex systems into these intervening at the systems level, not just at the intervention level. And so it has actually meant that we've been using a lot of implementation and design-based interventions and trying to work intentionally at the different parts of the system. So don't know why I included that slide. We worked a lot with networks in Minnesota where I was, but in the example I've been using today, this Washington project with paid family medical leave, we're assessing the policy field. We're working in depth with the state agency, and we are going to be tracking and trying to influence the way that frontline workers are communicating this policy to the groups that are historically underrepresented and are not utilizing the program in the way that the state has to create the public value of equity. And so it's allowed us to develop and use design-based interventions to try and change the way those strategic action fields actually operate. So that's just a bunch of stuff you could read if you care. Because I was assuming that there are a lot of people in this room that like to write things to other scholars. So maybe these articles may be helpful. So I'm sorry I talked so long.
Thank you. Yeah, thank you so much. So much of what you said really resonates with what we were talking about, and also kind of pushed the needle for me, at least. So yeah, thank you so much for sharing those ideas. And we'll move it over to questions now, both from the room and online. Does anyone want to kick us off with a question? Yeah, and come.
Jodi, thank you again for your wonderful talk. So I want to know your understanding about the role of evidence in policy making and implementation. In the field of medicine and public health, it's very evidence oriented. So there is the sense of evidence-based intervention. And then in the policy field, I think it's more like the evidence-informed policy implementation. So I would like to hear more of your thoughts on that.
Yeah, thank you. It's very important to make the pivot you've just done, which is, I think, as scholars, our strategic action is to assess what is the degree that research-based evidence is important in the field. It's not surprising to me that implementation science is grown up in medicine, because as you say, Yafan, most people in the field believe that research-based evidence is important, period, part of their professional identity. As we know, many fields don't necessarily believe research evidence as more legitimate than other forms of evidence, experiential evidence being the most, political evidence being another. And so as a scholar, what I have worked mainly in fields where research-based evidence is questioned. Early childhood programs have been tried to be influenced, right? Workforce development, welfare to work, income-based programs, there's very little research evidence. And so it has changed the way I think about intervening into implementation systems. Sometimes rather than bringing some summaries of research, we have conversation. So we use evidence-informed interventions, dialogue sessions, design sessions, where people are bringing their knowledge and having design charrettes where a social worker and a family and a program administrator are sitting down together to make sense of how to improve the anti-poverty program that they're all being touched by, we will then bring in the middle of that conversation, well, let's tell you what some research says about this. But the research is more of an input to the dialogue rather than starting. My imagination is that you all get to start with the research-based evidence because there's a little bit more belief in the legitimacy of it in the implementation process. Does that help, Yapa?
Yes, super helpful. I think the differentiation of different kinds of evidence, including like the research evidence, clinical evidence, maybe there are also managerial evidence, historical or political evidence. I think that kind of distinction is super helpful. Thank you so much.
In the chat, I see Sarah.
Cyrus?
Oh, thanks so much. Great talk. You've put up a slide on the differences between implementation and innovation, and immediately I was struck by the question that bothers me every time I have to write a grant that is IAS focused. What do you write in that section of innovation in implementation grants?
Yeah, so this really hinges, this great question. This really hinges on how much in the grant you are saying you are going to replicate, that your purpose is to replicate with fidelity. And to step back from that and say, you want to figure out what part of the intervention, what's the, in the implementation science world, we talk sometimes about the core technology, like the core components. And so rather than saying you're going to replicate with fidelity, to really identify and allow the sites to identify what are the core components that seem to be relevant in creating desirable outcomes and letting the other things vary. So you're trying to support the take up and replication of the innovation, of the idea, knowing that the change is going to look a little bit different depending on the context. Does that help, Cyrus?
It does. It does. Yeah, it's a question that is, yeah, that's an interesting phrasing of it. Yeah, thanks.
Patience?
Yeah, thank you so much, Jodi. I'm just thinking, based on your definition of social skills, as you just shared with us, I'm wondering if everyone is count to be an implementation scientist, or to put it better, can everyone lead implementation for us to get a kind of results we desire? I'm thinking otherwise. What are your thoughts? Thank you.
Yes, Patience. I actually think one of the things that I like about this theoretical framework is that it does mean that almost anybody can be an implementation change agent. And I think when I'm looking and learning about in places in Africa, public health interventions have become more subtle, right? They've realized that sometimes what you need in a village is a trusted grandmother to be the person that legitimates the program, or that helps people to tell a story about why the program makes sense given the people and their experience. That is consistent with this framework, that that many people in that social system, in that field, can have a role in helping provide sense-making and legitimacy to the intervention, or to challenge the legitimacy of the intervention. And so part of the reason why we don't see take up all the time is because key actors in that field are saying, yeah, that's not relevant. That's not relevant to us or our way of doing things. And so I think as people care about trying to improve lives, it means that we think more intentionally about the people in that social context and the roles power values that they bring to understanding the intervention.
Great. Thank you so much.
Okay, I think we have time for one more question, and then we're gonna have the introduction of the new initiative Lapis. So Andrew?
Yeah, thank you. I hope you can hear me.
Yes.
No, thanks. It's a great presentation. I wanted to hear your experiences on those are two aspects that have been presented. One is the policy itself, then there is implementation. In most places, these two things face a lot of challenges, mainly at national level, for example. There are policies, but they are not implemented at that level. They have to be implemented somewhere else. So what have been your experiences in terms of matching the policy itself, or where, for example, you want to deal with an issue and the actual implementation? How do you marry? What are your experiences with marrying the two?
I will tell you, Andrew, that part of this journey has made me question my own hubris when I was in my 20s to think that policy was going to provide the solution to the challenges that we see in the world. I think, and I always say to my students, policy is just one tool, and it really is about the resourcing of the idea behind the policy that makes the difference. One of the challenges, I think, is that many people who are in roles of setting policy, either in governments or in large foundations, because I actually feel like that has been something that's been fairly under-theorized, the role that large foundations play in setting the agenda of what policies are understood to be legitimate or resourced. We see that with the Gates Foundation right now in many different ways. That they need to understand more about context, or give the people, to give more legitimacy and significance to the people who do understand the context, that if that implementation translation does not happen, the translation of the policy idea into the system, that is why we have either no implementation or subverted implementation. Policy is a very blunt tool.
Thanks so much for great presentation. Thanks everybody for your great questions. I feel like you might get some emails after this. So now I want to hand it over to David and Yunfeng to talk about Lapis.
Sure, Yunfeng, I can kick it off if you want to then follow up. How's that sound?
Sounds great.
Okay, cool. So Lapis stands for, I think, Learning to Action in Policy and Health System, Policy Implementation in Health Systems. We just tried to find a way to throw all the words together to make it a nice acronym. The idea for starting this initiative came from, I think, two different but related streams. One was about a year ago, I started to sense that there were a number of students in the implementation science program, master's students as well, and others who were kind of signed up to do implementation science, but really what they were hoping to get skills in was health policy and systems research, okay? Which we don't have a kind of a degree program or kind of training in this. There's in health services or health systems of population, there's stuff going on in this space, but not on the global health side. So we wanted to try to find a way to get students more opportunities to get training and methods that are not just sort of like implementation science as narrowly understood within the way the NIH and other people do it, but like a more broad kind of approach, big tent implementation science. The second was in the process of the department's strategic review, or setting its 3-year strategy. There was a very strong feedback from country partners, and mostly in low and lower middle income countries, that the University of Washington here in Seattle was very biomedical. Our Department of Global Health was very biomedically focused and doing things that are like, fix this HIV program here, do this thing over here, and not enough on health system strengthening, not enough on cross-cutting issues like primary health care, universal health coverage, and other sorts of things. And my own research interest is in this cross-cutting space, and I'm a general internist, so I can't be bothered to focus on one disease or intervention at a time. But I think helping to kind of bring more of that thinking into the way that we've typically organized ourselves in the department around specific diseases or programs or technologies, so that we kind of answer some of these really important needs around health systems that are frankly underdeveloped. And how can the research we do contribute to health system strength? And so the idea with LAPIS is not to be like a new initiative led by faculty to do a typical research program, but really to be more of a resource hub for faculty, staff, and students who are interested in this space where we really, all we care about at the end of the day is effective implementation of stuff, programs, and technologies at scale. And the at scale piece, I think, is really relates to the policy thing that you're talking about, which is that you can do a lot of research on community health centers and colorectal cancer screening in the US, but like it's a very different thing to talk about rolling out a program nationwide in a whole country, and understanding the factors that lead to that sort of scale up and sustainment of new interventions and programs, I think is really kind of part of our core. And so really we're trying to bring together people who are interested in this stuff from different disciplinary perspectives, including across campus, including people working in public policy or business or law, to help think about implementation science in a broader way, to think about health systems in a broader way. And so I think we're a lot of our agendas around education. So getting cross listings of courses, so people know that they can go and sign up for a course at Evans if they're interested in this stuff. People who have mentors, faculty mentors for doing thesis or dissertation projects, but also to really connect faculty and staff who are interested in this stuff to really build up the research program. So for instance, if Global Watch is doing more, wants to do more at the sort of policy and systems level, that there's ways to kind of find expertise within the department and within the university to strengthen their grant writing. And so helping people to identify resources to do more of what they want to do, getting into these sort of more system level issues. I could talk for many minutes about that, but I think I'll stop there. And Yunfang, I think, what do you want to say?
Thank you so much, David. I think that's a great introduction of LAPIS to the audience. And Jodi, today is so special. We consider this as the soft launch of LAPIS. And it's so great to have you to give the fundamental discussion, to lead the fundamental discussion about like policy implementation. And we do appreciate the cross-school collaboration that we are envisioning through LAPIS, as well as collaboration with Evans. And for LAPIS, the goal is really to provide the platform for students, faculty, staff, and the country partners for us to have the constructive debates, because we have like all of the distinctive disciplinary training. And then we are also focusing on slightly different research questions, but there are also so much in common that we can share and debate. So I also want to use this opportunity to make several announcements. One is that if you are inspired by Dean Jodi Sandfort's talk and have your idea and want to write out something, there is a special issue, Learning for Action in Policy Implementation, that guest editing. So welcome to submit your manuscript or even just an abstract to us. And the second thing is that we are really focusing on like building the educational system for students. So Jodi and I have been talking about a new course on policy implementation. In addition, in the Department of Global Health, we are going to have a series of new courses focusing on policy implementation and health systems. For example, in spring quarter, I will teach a new course, Comparative Health System. And in addition to the formal courses, we're also going to have the seminars as well as the symposiums as well. For example, currently, David, Alicia, and I, as well as the WISE leadership, we are in the process to thinking and organizing and planning for a symposium around summertime next year. So there will be more of the information to come regarding the Brown Bag Lunch series, as well as other exciting opportunities. Thank you so much for attending this event today, and hopefully that will be the beginning of our exciting journal for policy implementation.
Thanks, David. Thanks, Yunfang, and thanks everyone for sticking around. I know we've gone over time, so we can say goodbye now, and thanks for joining, and looking forward to more conversations in this space moving forward.
Thank you.